Hi, my name is Madison Blank and I teach kindergarten through second self-contained special education. I teach students with the most severe to profound disabilities, and they have needs in the areas of physical, cognitive, medical, emotional, behavioral, social, and communication. And so within this position, I have been able to see what our school's process is for assessing and referring students who have suspected speech sound disorders to get them into speech therapy. So at our school, our process is all starts with a referral. So the referral could come from a parent or from a teacher, and that is basically just that person saying, I have concerns with my students or my child's speech production and their speech sounds. And so once this referral has been received, our speech therapist will conduct a screener. And in this screener, it's just a shortened version of an assessment that kind of lets the speech therapist know whether to move forward with a full battery of testing on this student. So once the screener has been completed, there are several little assessments that are completed as part of this evaluation process. A standardized assessment will be completed. I know that the one that my school uses is the Goldman-Fristow test of articulation. So that is a standardized test. And in addition to that, our speech therapist will give a hearing assessment. We give vision and hearing assessments to all students that are being evaluated for any disability or any area of need. However, it's very important, especially when looking at speech sounds, to determine if there is a hearing impairment that might be limiting the student's ability to correctly produce those speech sounds. In addition to that hearing test, there'll also be an oral peripheral exam, and that looks at the mouth and the teeth and the tongue and the structure of the student's face, just to see if there is any structural impairments or structural differences that might be limiting the correct production of speech sounds. And then also, in addition to all three of those assessments, our speech therapist will complete a parent interview and a teacher interview. And that just gives insight on any family history of speech or language disorders. That gives the speech therapist a view of kind of how the child's speech sounds at home and how the child's speech sounds in the classroom. Once all of that information is collected, the speech therapist will sit down and meet with the team, so the parents, the teacher, and the speech therapist will meet about whether the results of the evaluation warrant referring the child to speech therapy services at the school. Once that decision has been made, the speech therapist will write an IEP, individualized education plan, that lays out when the child's going to be getting speech therapy services, how many times a week, how long are the sessions, what are they specifically working on. And so the speech therapist will hold that meeting to get a plan in place for that student. I know there are several roadblocks that my school sees. Our speech therapists are always backed up with evaluations and referrals and conducting assessments. And they are not only doing that all day long. They're not only evaluating, they are also providing speech therapy services. And so sometimes it's difficult with the time constraints of you have a certain amount of time between referral and evaluation and IEP for our speech therapists to get everything done. I also know that there are some limited resources at schools. They might not have access to all of the new screeners and certain assessments to be able to provide speech therapy services, speech therapy evaluations to the students that need it. So overall, there needs to be more funding in special education, but specifically speech therapy, and the amount of resources that we have, the amount of assessments that our speech therapists have access to, and the amount of speech therapists that each school has, in order to properly evaluate and determine the needs that these students have and get them into speech therapy as quick as possible so they can start receiving the services that they need.